Thank you, Congressman Roy and members of the United States Congress for holding this hearing today, the Heritage Foundation for hosting it, and Drs. Atlas, Bhattacharya, and Kuldorf for your efforts to speak the truth about COVID and our response to it. It's been 2.5 years since the deaths of my in-laws, Mickey and Dean Newman, who contracted COVID-19 in their separate elder care facilities here in New York. Our families were never notified of Governor Cuomo's mandate to send over 9,000 COVID-positive patients into New York nursing homes, and we still don't know why he decided to do it. There were other facilities provided by the federal government he could have used, like the USS Comfort Ship and the Jacob Javits Center. Those went virtually empty, and instead, his health department decided to put the sickest people into the places where our most vulnerable resided. Since May of 2020, myself and thousands of families have demanded answers and accountability into why those deadly decisions were made. But instead of addressing why the tragedy happened on his watch, the former Governor Andrew Cuomo, his administration, and the New York State Health Department tried to cover it up. COVID killed over 75,000 New Yorkers. Over 15,000 of them were our precious seniors. Andrew Cuomo knew early on that if the virus got into the homes of the elderly, it would spread, quote, like fire through dry grass. And yet he continued to flood nursing homes with sick patients for 46 days straight before he finally decided to rescind the order and scrub it from the Department of Health website. By then, it was too late. His COVID-19 wildfire in nursing homes was already out of control and impossible to put out. Andrew Cuomo wasn't the only leader to do this. There were several others that had the exact same wording in their state mandates and barred nursing homes to even test incoming patients. New Jersey, California, Michigan, and Pennsylvania all decided to flood their nursing homes with sick patients despite the desperate pleas from the nursing home directors and the other options they had. Almost 3 years later, we do not know why. We need to know the origins of the executive order that I believe was a death warrant. It wasn't written by real scientists who knew grave danger. Our elected leaders, the one we trusted to keep us safe, put our loved ones directly in harm's way. And then they died without being able to see their loved ones. We weren't able to have proper wakes or funerals. Body bags filled with corpses were stored in storage trucks. Family members were devastated. Our parents and grandparents died scared and alone. New York was one of, if not the worst prepared states in the country. And if we don't figure out what went wrong, this will happen again. But only an independent, no-hold-barred probe with subpoena power can uncover the truth, and that has yet to happen. The investigative reports that were done in New York by State Attorney General Letitia James and our comptroller Tom DiNapoli found that the Cuomo administration initially undercounted nursing home deaths by half and had a strategy to cover up the true results amid a federal probe. This was a Category 5 disaster and requires urgent priority, and I will continue to advocate for as long as it takes. Just because Andrew Cuomo no longer is in power doesn't mean the rest of us are done with trying to hold him accountable. Because although our loved ones can never defend themselves, it's up to us on their behalf to keep using our voices for justice on their behalf. And thank you for having me today.